Guys, do you know what is pneumonia? Yes guys, many people know about this kind of respiratory infection called pneumonia. So before starting this video, I would like to tell a grammar point regarding this pneumonia. So if you see the spelling of this pneumonia, that is pneumonia starting from the letter P. So if it is starting from the letter P, then it should be pronounced as pneumonia, but it is wrong. It is pronounced as pneumonia. This is because P is silent. That's why it is pronounced as pneumonia and not pneumonia. Well, today in this video, we are going to learn about pneumonia, its causes, symptoms and treatment. So hi, my name is Atharva and welcome back to my channel. So guys, in globally 450 million cases of pneumonia have happened worldwide. How much? 450 million cases of pneumonia have happened worldwide, and out of that 45 million cases have happened in our own country, that is in our India. So globally 450 million cases, and in India 45 million cases that is happened in India, and out of that 2.5 million deaths happened worldwide. And last year, that is 2023, it is 41,000 deaths that is happened worldwide. So by these cases and deaths, you can understand that pneumonia is a common disease and it is also one of the dangerous respiratory disease. So what causes pneumonia? Pneumonia is basically caused because of many kinds of virus, but as per doctor, there are mainly two kinds of virus that causes pneumonia, that is influenza virus and rhinovirus. So this influenza virus is the same virus that causes flu, and this rhinovirus is the same virus that causes common cold. So what happens inside a person's body when a person is affected with pneumonia? So for that we need to dive into their body to learn about it. So guys, as you know that our lung is a main part of our body. It helps in the purification of our air that we inhale and exhale it. So what happens is that when we inhale the air, then apart from that air, there's some composition like some virus are there and some dust particles. So these dust particles are trapped by our nose. That is because in our nose there is some cilia hairs that is trapped these dust particles, and even in our trachea also there is some hairs, that is cilia hairs, that is present in the lining of the trachea. So even these hairs will also stop the dust particles that is present in the air. Then after that it will travel to the lungs, and from the lungs it will travel to the alveoli. Then in that alveoli, what are the other gases are there, that is carbon dioxide and other gases that will be exhaled out of your body. And what is the remaining oxygen is there, that oxygen will be diffused with the capillaries, that is the red blood cells capillaries, and after diffusion it will send to whole parts of the body. But well, in the pneumonia, apart from these gases, even some other microorganisms and some virus also enters to our body, and as they are small, they cannot be stopped by our hair. So that's why it will go to trachea, and from trachea it will go to the lungs, and from the lungs it will reach their alveoli, and in that alveoli these microorganisms and virus starts to multiply, and when it starts to multiply, the immune system of your body becomes activated and it produces antibodies to fight against these viruses, and after fighting this produce lot of mucus, and these mucus will be stuck in the alveoli, and that's why people feel difficulty in breathing, and this condition is called as pneumonia. So what are the symptoms of pneumonia? Because if you know the symptoms earlier, then only it will be good for treating this pneumonia. So what is the symptoms? Basically, the symptoms of pneumonia is that people will feel difficulty in breathing, they'll get chest pain, they'll get fever, fatigue, and even they'll feel loss of appetite. So these are some of the symptoms of pneumonia. So how can you treat pneumonia? Basically, doctor will give two kinds of medicine, that is azithromycin and erythromycin. Azithromycin is mostly used for curing pneumonic patients, means those who have pneumonia, for that these medicines are used. Whereas this erythromycin is used for all kinds of respiratory disease like asthma, tuberculosis and pneumonia. But whatever this medication I am telling, this is just for knowledge purpose. This is not any treatment I am telling to you. If you feel these kinds of symptoms, then for it, immediately you have to go to doctor. Then this doctor only give you the medication. Just whatever I'm doing, that is just for education purpose. So I hope you have understood about pneumonia. Before video I have discussed about asthma, and now in this video I am discussing with you about pneumonia. And you know that asthma is also a respiratory disease, and even pneumonia is also a respiratory disease. So what is the difference between this asthma and pneumonia? So let's see them one by one. So if you see the causes of this asthma, then asthma is mostly caused because of the dust particles and the pollen grains, whereas this pneumonia is caused by virus, that is mostly because of influenza virus and rhinovirus. And if you see the symptoms of asthma, then the symptoms of asthma is that people will feel difficulty in breathing, chest pain and regular coughing, and also people will feel a wheezing sound when they breathe. And in pneumonia, apart from these symptoms, other symptoms will also people will experience, that is fever, fatigue and loss of appetite. So if you see about this contagious, then this asthma is not a contagious disease. That means it cannot spread from one person to another person. Because pneumonia is a contagious disease that can spread from one person to another person. So these are the sum of the difference between asthma and pneumonia. So I hope you have understood about pneumonia in today's topic. You can like, share and subscribe. You can comment also in the comment box. So thank you. Bye.